This topic is caring for your skin and nails, managing side effects while actively receiving cancer treatment. The first topic will be nail problems. Certain chemotherapies do cause a lot of nail and skin changes to the hands and the feet, as well as the fingernails and toenails. Some people do get real dark yellow, cracked, and very brittle nails. Cuticles may become inflamed and painful, and lines and indentation on nails may appear. Should be very observant so that no infectious process sets in. Any questions you have, just be certain to speak with your provider. Some ideas for caring for nails is to keep them relatively short, and sometimes using a file versus a clipper so that the skin isn't nicked and cause an infection. Wear gloves, certainly when doing household chores with chemicals or abrasives. Avoid manicures and pedicures at shops. If you can do self-cares, that's a little less risk for infection. Don't be overly aggressive with trimming your cuticles. Just moisturize those areas well and do a manual pushback on those. Massaging the cuticles with lotion and hopefully avoid splitting and hangnails. And then again, letting your provider know if you have any concerns about that. There's a good section in the Oncology Rehab Patient Guide that you can reference any of these topics. Common skin problems you can get, and this is whole body skin dryness, itchiness, rashes, flushing or redness of the skin, and peeling of the skin as well. Certain chemotherapies, especially of the hands and the feet, and hyperpigmentation, meaning just looking kind of darkened. Some chemotherapies are specifically rash-inducing. Erbitux is one of those. If you get this skin rash or from any chemotherapy, protect your skin from sunlight. Don't scratch or break the skin. Preferably don't use a sunblock unless it's been reviewed with your provider. Sometimes indications for chemotherapy or even antibacterial, like a Neosporin kind of thing, or even prescription can be given if that rash is significant. If you're at home and you have IV insertion that's left in, be certain to be aware for warm, tenderness, swelling, itching, or burning, and flag your provider immediately. Radiation therapy can cause treatment area changes to the field that's being treated only. You can use hydrocortisone if the area is itchy. Vitamin E is a good moisturizer, but should not be used until radiation treatments are completed. And then one rule of thumb is to avoid applying products for 4 hours prior to your daily radiation. Some of the skincare products that we have recommended, certainly if you want to use a certain brand of your own, just have us review that. Use mild soaps, cleansing lotions, and creams. Some of the over-the-counter products that are frequently used are Aquaphor, Vanny Cream, Udder Cream, or Bag Balm, the old-fashioned type, and hydrocortisone cream, again for itching. Aloe vera, commercially bought, or the plant is okay. And Lindy Cream is kind of a specific one that is kept at the pharmacy at the CentraCare Health Plaza. And if you're looking for any cancer care product, they have a very, very nice variety down at the Plaza Pharmacy. Bathing tips just for good skin and care health is lukewarm bath water, avoid long hot showers, be cautious with shaving if this happens, discontinue until the healing takes place. Sometimes electric is better than blades, and then a soft towel after showers rather than rubbing vigorously. Some skincare tips just for in general: eat well balanced meals and maintain hydration. Hydration is a significant issue for a lot of people, so really focus on that intake. Avoid sun and certainly prolonged sun exposure. And if it's been reviewed with your provider, you can use a SPF 50 or higher sunblock. Consider integrative therapies such as acupuncture and healing touch, which is available in our healing center. Generally keep your home cool and humid, avoiding heat pads, ice packs, or bandages on affected areas, and changing positions periodically if you're chair or bedridden to get off of pressure points. Any questions, please speak to any of your nurses, your providers. Thank you.